All right, so welcome. I'm Patricia Boyle. Let's see, a little bit about myself. I have a blended family with 4 daughters between the ages of 22 and 3. So it gets colorful at times in our house. I grew up here in Southern California, and then I did some time in Boston, Dallas, and Atlanta. So I've been around the block a little bit. And then came back to go to nursing school because college is very expensive everywhere else. And I landed at Loma Linda. Um, I really enjoy the Christian background and the whole person care. So it was really appealing to me. I've been a nurse and RN for nearly 15 years, most of that in the ER. And if you have any questions, you can email me after we're done. So this is not the Loma Linda ER, but it is a typical ER. I've worked in a lot of ERs out from LA USC all the way to Loma Linda. I haven't got out to Palm Springs, but I hear a lot that the hospital out there is fantastic. But this is what it typically looks like. So you can imagine my everyday was full of a lot of smells, sounds, visual, overstimulus stimulation. And that's kind of where our teenagers end up, right? So my goal today was to educate you guys like a little bit about the different levels and why screening at the really low level is so important. Because if you look to the bottom left, there's an open bed, right? So somebody was there and they left. And that's usually what happens to our teenagers. So they come because they've told somebody or, a friend or whatever that they want to take their life. And so they rush them to the ER and then they're sitting there for days. And so you can imagine that if you don't feel like being on the earth, that being in this ER is probably also somewhere you do not want to be. And they usually panic and take off, or the parents, don't want to do it anymore and they end up leaving and never getting care and end up either back in the ER or ending their life. So as an ER nurse, way before COVID, I started seeing the amount of teenagers coming into the ER was going higher. And then unfortunately, during COVID, we got down to ages around 8, right? So these kids don't even know what they're saying when they say it at 8 years old. They just know that they're not happy and they want help. And this is where they end up, which can be really traumatizing for them and a memory they don't forget, which just really adds to my passion of why I felt like, why don't we extend it out to the schools and kind of get them help so they don't end up here as much as possible. So there's been a 51% rise in ER visits for mental health. And then most of them, this was my most pressed statistic, was that they had seen a healthcare provider, 90% of them in the last 30 days. So it's not like they're not asking. And some of that can be the school nurse, and I know a lot of school nurses are complaining about it. And I actually speak at next week's California School Nurse Conference about this. So some of the school nurses will start to be on track with what's going on and kind of like revolutionize this so that we can help protect our teens and our kids. So kudos to Palm Springs on being some of the frontiers on it for sure. All right, so my objectives today, just to define depression for you, what screening for depression looks like, assisting anyone, including yourself, with self-care, building a mental health relationship with those around you, and then the flow of how we're going to screen the students. So depression is really simply made up of 2 things. It's the overwhelming feeling of sadness, but also a loss of interest in things you like to do. I would like to say I'm not in a sterile environment. I've felt like this, especially in December in the school district. You're burnt out, you start getting a little grumpy. You don't feel like doing the things you usually like to do. And then it starts trickling over into your daily activities. So taking a shower, doing your hair, for me, putting on makeup, these are things that you just don't feel like you have the time to do anymore because you're just getting burnt out. And with depression, we
Does that sound like fun?
We look
Okay, so,
at the
yeah,
last two
there's plenty
weeks.
of room on the range right now.
And that's kind of the indicative factor is the last 2 weeks. And you'll see that pull through in the screenings. So there are a couple things that make up the recipe for depression. Number one, genetics. Two, trauma and the childhood events, which is why you see the new ACEs coming around and being pressed into the school districts. And third is self-care. And lastly is resiliency. And resiliency is actually kind of an ingredient all on its own. And there's things that make that up as well. But the fun part about genetics is that depending on what you do with your self-care, there's a new field called epigenetics. So you either turn on or turn off things on your DNA that open you up, predispose you for depression. And all of these impact your mortality rate. So you'll see that later in this slide, but it's not just one thing that makes it up, but it's a lot of things. And I think a lot of people now can relate because of COVID and everything that we've been through. So being in the school district has been very colorful because I've had some school nurses tell me that mental health is just not their thing. I've also had some school psychologists, and they're all fantastic and everybody works really hard. The school psychologists go, you just want to give a medication. And I'm like, I actually don't. I actually want to stop it before they need it. But my analogy for medication is everybody has baggage that they're carrying around, and some teenagers, some adults are carrying around the picture on the left. They are just every day lugging around so much luggage, it gets painful. And some kids on the right, they have the baby shark backpack, like a 3-year-old. Their parents are still together, they have a great support system. So, of course, they don't need medication. But it would be cruel if somebody, was helping you move and said, hey, I feel a little sore, and you didn't say, hey, you want some Tylenol or ibuprofen or, ice, you want to rest for a little bit. So that's kind of where medication comes in with mental health. I know some providers try to talk about it like, hypertension, high blood pressure medication, like it's a medication that'll help you. But it just transforms lives. And I try to say it's like a speed bump. It just gives you a little bit so you can handle today. And in the future, you don't have to be on it forever. So there might be some students, if they meet their criteria, that will need to see a provider, and kind of just supporting the fact that it's helpful, and it'll help them through their everyday lives and start to help them with their assignments, and things like that. Just a kind of basis for you guys to understand medication a little bit more. So here's the screener that we'll be using for depression. It's called the Patient Health Questionnaire 9. It's been around for nearly 20 years. It was adapted for adolescents because it had funny things on it, like, do you still like to read the newspaper? So they just tweaked little words like that to have the teenagers feel like they're reading something closer to what they understand. But if you go through the questions, the first is what I said, feeling sad or down. For a lot of teenagers, they're going to feel more irritable. So that's where you get the moodiness. They don't necessarily feel sad at first. They just might, start getting in arguments with friends and whatnot. And then second is the interest in doing things. Third, falling asleep, staying asleep. Sleep is so integral to depression, and I would say like 50% of people struggle, adults included, with sleep. So the self-care will really help them to start to understand how to take care of their sleep. Next is appetite. Number 5, they're feeling tired or run down. And that kind of tells us what kind of depression they have. Number 6, do you feel bad about yourself? That's our guilt question. They have this later on, pervasive feeling of guilt, letting down their mom, letting down their dad, they're not getting the grades, and it kind of just starts building up. So seeing where they're at on that. 7th, trouble concentrating on the schoolwork. Depression and anxiety show up as a lack of comfort, as a lack of concentration, sorry. So I know sometimes you'll see that ADHD overlap because they kind of have the same concentration algorithm there. So number 8, moving or speaking slowly, that's actually a certain kind of depression. And then number 9, thoughts that you would be better off dead or hurting yourself. Now in California, we use it's called the CSSRS. That's the quick 2-4 question suicide screener. And so this number 9 question alludes to that. So that's why I prefer the PHQ-9, because you get straight to the point on the do you feel like hurting yourself? But then it also gives a couple of other uh, more expansive but still quick ways to decipher kind of what's going on and what they can help themselves with. So my hopes is them seeing it now in the future, if they're going, hey, I'm not feeling 100%, let me take this and see where I'm at on my score. Have I gone up or gone down? Then they kind of know where to fix things. So you'll see the score on the right. When we're doing it with the students, they'll all get a message at the end of the survey, and then depending on their number is what it's going to tell them what to do. So this is what it'll look like. So in the Qualtrics, depending on their score, like on the left, it'll say mild depression risk. And then I try to give them a note, please work on your self-care to keep it low. I gave everybody the 988 number because there might be some students that come out of the class that are friends that have a higher score, and these lower risk students will be able to help them, if that makes sense. So then on the right, you can see if they're all the way at the top, the severe, that means they've said yes and 100% to everything. So they need to see somebody, a counselor. And then also, if they don't end up going to the counselor immediately, that they also have that number and they understand that you can call or text. And I know it's been on campus a lot of places, but hopefully this being, right in front of them and being their tailored score right in front of them will help them to start advocating for themselves. So on to what we're going to do after we screen them, because we're not just going to say, this is your number, you're awful, you're not 100%, and goodbye. So we're going to help them create a self-care plan. And we have transitioned in healthcare because of ACEs, because of childhood events, on this model of trauma-informed care. And the real difference is a lot of the medical doctors try to focus on diagnosing you, what's your illness, and let's fix it. So there's that stigma that we're trying to change. And so going from you have an illness, let's fix it, to what are you going through today? What's your experience? What can I help you with to make your person whole today? So that's what we'll be working on. And thanks to the ACE movement, they give some really good information. So just a couple of key notes to trauma. It just affects everything: memory, concentration, then your actual overall health. It impacts how you have relationships with others, but also most importantly, how you self-soothe, right? So that's why we're getting all these teens that are trying to put their vape pens in the toilet at school because, they're just trying to cope through the day, and that's the only way they know how to self-soothe. So we're hoping to give them some new skills on that. And then what they believe. And that's a lot about mindfulness. And that comes through self-care and just taking a minute. So the big trauma-informed difference is that just to know that trauma is common. There's a lot of types of trauma, and we don't have to diagnose it, but just know that everybody has a little part of it. And you can screen for it through ACEs, and everybody's number is different. Like if I only have a 2, that doesn't mean that my 2 isn't hard to deal with, because everybody handles things differently. Second, just recognizing the signs and symptoms of trauma, and that there might be something going on with the students. Third, safety, just responding respectfully to something that you might see in the student. Not doing it sarcastically or in front of others. I know it could get kind of playful at times, but just keeping that safety so that they'll be willing to talk to us. And then at that moment, we can lastly empower them to make a difference for themselves. And that might not always go the way we want it to, but at least we could give it our best shot, right? So per the ACEs website, if you have 6 ACEs, that takes 20 years off of your life. So we're just trying to reduce some of that by doing the self-care. So that self-care looks like the one on the right. And it's 3 pages. And as you can see, there's just little check marks, and they just check mark what they think will go well. So like, I know it's pretty small, but it says like healthy relationships. And under that, spending more high quality time together with loved ones. And then they just check like what their goal basically. So it gives them a way to tailor it to themselves and empowers them because they're the one choosing it, right? We're not telling them, hey, you should eat broccoli. They're choosing what it is. So just like a tree trunk, there's a lot of layers to trauma and depression. It can definitely cause the crack through all of it. But if we're giving, these are my real life examples I try to give my students when I see them in the health office, especially the ones that come in all the time. Being proactive. So like in the holiday season, we're going to hang out with our friends before we have to go hang out with Auntie May, who we don't really like that much. So those small moments of spending time with people that we like, sleep. There's a lot of innovative things that people are trying to put out there for us. If you take a shower and elevate your heat at the evening, Epsom salt has magnesium in it, or taking a magnesium pill kind of starts relaxing your body. Also a routine to get your body ready for bed. Food, green veggies, decrease our hormones, especially for our adolescent females. Citrus helps with the inflammation. That'll be really good. That's where the orange after the games comes from. And then protein with vitamin B for energy. So a lot of our teen girls don't know like why they're falling short on energy, and it could be one of those. So just making sure it's balanced. And then exercise, weightlifting is actually the best for depression, and just making small steps. And then lastly, meditation or your spirituality. Spirituality is very much integrated into your hope and your whole person care and how your depression is affected. So there's just a lot of things that you can do. It doesn't have to be a denomination, but just meditation or a nature walk. There's a lot of sound waves, I put there 432 hertz, that are starting to be connected with just relaxation. So we'll be using grit as one of our skills to see if their self-care is helping them. So that was created by Angela Duckworth. So you see on the left, the students that aren't doing great, they usually have a fixed mindset. And then, they start to get negative. And then it just gets lower and their self-esteem gets lower. Where on the right, if they're really taking care, their self-care, they have a growth mindset, they're learning optimism, they're getting strength, and then they feel like they have goals that they want to live for. And that's really become the biggest driver of the depression and how the students are feeling. So these are the 2 scales we'll be using. So they'll have the one QR code to do the depression screening, and then they'll have a QR code to do this flourishing scale on the left. It'll show how happy they are essentially currently. So I lead a purposeful life. My social relationships are supportive. I'm engaged. So they're all questions that allude to happiness. And then on the right, it'll be the grit scale, which I was just talking about. So just, can they overcome setbacks? Do they have projects they keep on working towards? So that looks like the ones that want to go to a 4-year college, they're on the swim team, they're trying their hardest. But there still might be some trends on which ones they're lacking on. So we'll be excited to see where that goes. So this will look like they'll have a packet with the one on the left with the 3 QR codes. This is if we were doing it by phone, but we'll figure it out by Chromebook. And then they snap the QR code, they get their risk level, and then they'll have this paper version of the self-care on the right. And the coach will walk them through some ideas or just reading through it and checking some off, and just being that go-to person on just reminding them, weekly or whenever you feel it works through your relationship with the students that, hey, how's your self-care going? Keep it up, you guys. And one of the biggest things why the state is pushing it into the teachers' hands is you guys are the ones with relationships with them. And that really is what mental health comes down to. When I'm seeing patients, whether it's in the ER, if it's outpatient, it's just having the relationship with them and getting them to feel like they can talk to me and me giving little tweaks of advice when they ask for it, you know? And kudos to all of you guys because that's what you're doing daily. And I know it's really draining. So hopefully you've learned something, not just for the students, but maybe something you can take home for yourself. And if you have any questions, I will take them. And if not, here is the QR code for the lesson plan today.
Will you have pencils for all the kids, or do you want me to have those for you?
I can bring them.
Okay.
Yeah.
And obviously, you'll have all the paper copies made. I'll make copies of the permission slip today and try and pass them out today.